Okay.
All right, here at Broward, we're very protective of our students and the public, so we try to create an environment that is stress-free, but also is protective of them on a physical level for germs, bacteria, viruses, anything like that. So in the room itself, we do have what we call a clean room purifier, which is much, much better than just a room purifier. So we do keep the air as clean as possible, but the contact happens between the therapist's hands and the person's body. So we do have what they generally refer to as a chemical glove. The product that we use is DermaShield Plus. So it does protect the skin from any harsh chemicals, but also protects it from germs, viruses, anything like that. This is what we use. It also comes in a liquid form, a fluid form, and all you do is put a very small amount. That is foam. You only need a golf ball size foam. This, you're just going to squirt once into your palm. Whoops. Rub your hands together and bring it all the way up to the elbow, because you're going to be using your forearms up to your elbow when you're doing a treatment. This will last for 4 hours, regardless of how many times you wash your hands. It will only come off when that top layer of cells sloughs off. They use this in a lot of different industries, like surfboard, when they're using a lot of the very, very caustic fiberglass material. Cosmetologists use this when they're using the very harsh, strong chemicals and dyes. And massage therapists should also protect themselves when they're working with the public. So we do that here. So first we do the DermaShield. And what I want you to look at is how you're going to set up your space, your room. Now you can decorate this. So if you have a nice tablecloth or a theme that you'd like to have, it's always important to set up an ambiance in the room for yourself, which you're going to be doing when you're out working in the field. So you can kind of get started now if you'd like. One thing you need to remember is when you're working with the public and they're on the table for the length of time that they are, their blood pressure is going to change. They will become lightheaded, and you want to be sure that they're protected when they get up and off the table. So we always offer to help, or if we feel there's a concern, we will help. But where you place their clothing is important as well. If you had a hook or something like that, you could put it on the door, but you need to put it up so they don't need to bend over to get their clothing. So we put this on the table. Now, what goes on the table as well is some way to tell time. We use these little timers. If you push the top button, there's a light that comes on and you can see the time. If the curtains or you're in a room that has any other type of timepiece, you need to do that because your time is very, very important. You have to keep to a schedule. They booked an appointment for a certain length of time and you have to stay within that length of time. So your timepiece is very important. You're also going to have some supplies with you. A washcloth, a hand towel, and some paper towels. We're going to clean their feet, prepare their feet for their massage. So we're going to use a product for that. Most people feel very self-conscious when they take their clothes off, but especially when they take their shoes off, more so for men than women, and they're concerned that their feet have an odor. Well, we're going to help take that fear away and allow them to relax because we're going to deodorize their feet. You're going to need alcohol. Alcohol is about the only thing that's really going to cut oil. And we've mixed regular alcohol with wintergreen so you don't have that medicinal smell. It smells quite nice. And you're going to need to clean your hands. So before you touch the body, you have to clean your hands. Before you touch their face, you have to clean your hands. We use a product called Vionex that is a waterless hand cleanser. So not only is it like a hand sanitizer, it's also a cleanser, but you don't need water for this. And it has a very pleasant odor, which dissipates real quick. So you're going to have those handy for your treatment. I'm going to demonstrate a couple of things before we get started that you'll need to learn to do no matter what your treatment that you're going to be performing is. First of all, always remember the most important thing for the person on the table, the first thing you're aware of, the first thing you try to do is protect their neck. and their head. It's the most vulnerable part of the body, so that's our main concern. So when they're first on the table, that's the first thing we're going to check. Whenever we move them on the table, that's the first thing we're going to check. So with Tony, I'm going to just roll up a hand towel and place it under his neck. You can use the face cradle, you can use little pillows. There's many, many different things that you can use to help support the head. But for the majority of people, you really just need a little bit of support under the neck, and that's it. Now, how are we going to pick the head up? All of these different things that you need to learn to do that makes your massage feel very good is what I consider table etiquettes. How to do it in a very pleasant and safe and secure way that is not jarring and disturbing to the person. So you want to keep the movements that you do to a minimum, especially on the head. So we're going to do this in a certain way. We're going to use the thenar eminence, the pad on the palm of the hand. You're going to place it behind their ear. You're going to turn their head, put your fingers under, bring their head back into the palm of your hand, and then lift their head up and place the neck. Now, support the head, take your hand out, and let them come back down on the pillow. It should feel nice and smooth to the person. You're not picking them up and dropping them several times, and you've got control of the neck the whole time. Now, you could do it this way and get the whatever you're going to place under their neck. There's a couple of ways to do it, but you don't ask them to lift their head, and you don't let their head drop. That's very important that you remember to do that. On the arm, it's not important with the man, but with women it is very, very important that you protect the breast area. So when they're on the table, the two areas that you're focused on protecting is the breast area and the groin area. They must remain draped at all time. It's Florida law. Unless you're doing a very therapeutic type service like lymph drainage for the breast tissue, you need written consent to do anything like that. But any other type of treatment, you can always use disposable underwear, which we provide here. There's disposable underwear you can use. But you still have to drape them, even though they have that on. Technically, that is a drape, but it's just for your own benefit that you keep them draped in those two areas. So when I move the drape around, I need to have control of it. I need to have control. So what we're going to do, another form of table etiquette, is which way do you position your hands. You always try to make the back of your hand, the dorsum, be what faces their body. So if I'm working on their arm, my hand is like this. If I'm working at the hip, my hand is like this. If I'm going under the body, my hand is going to be facing down with the fingers pointing away. You never point towards the midline of the body with your hands. So with the dorsum towards the body, I'm going to put my hand on the shoulder where the shoulder meets the torso. So I'm not on the torso, I'm on the shoulder itself. This is going to keep the drape right where I want it to be. You're going to uncover the arm. Whenever you pick up a linen or a sheet or any drape material like this, it's called an accordion fold. So we're just going to uncover the arm all the way to the bottom. Now, if you need to move the arm away from the body, you can. You go underneath the elbow and just pull it away from the body. Okay? I'm not going to move this hand. This hand is going to stay right there and not going to move because it's protecting what I'm concerned is the breast area. You're going to go proximal, which means right above, and medial, which means on the inside to the elbow. Push into the table. You always want to hear that vinyl. If you don't, you're going to pinch them and stab them with the end of your finger. Bring them out to 90 degrees. Notice this hand has not moved. This hand is still right here. Now all I'm going to do is push down against the table. I don't tuck under, I don't do anything but push down to anchor it so it's going to stay right there. I need to lift the arm up. I'm going to reach under and pull the drape up. But I have to get into position first, so I have to step to the side and assume what we call the horse stance. Feet are asymmetrical. One is a little bit forward than the other. The feet are turned out slightly, but they're much wider than your shoulder. which allows me to rock back and forth from leg to leg. Now I can lift him up slightly, go underneath, and all I need to do is grab the edge, the top edge of the drape, pull it up, bring it under the shoulder, and then let the arm come back to the table and just set it back down. This is going to allow me to move that arm without worrying about them being exposed, which is really important. A lot of therapists give up ranging, getting any kind of motion in the body because they're afraid of the draping might move, or the person might feel insecure. Well, if you do this, they're never going to feel insecure because they will always feel fabric up against their body. So if I did pick his arm up, both joints, wrist and elbow, bring the arm over. Notice how I positioned it. It's away from my body, so they're not touching me. I will not get oil on my clothing, and there won't be any intimacy between the two of us. His arm is well away from my arm. If I need to readjust it from here, I can. It's very simple. And then they don't feel coolness, they don't feel air, they're completely covered. To put the arm back, you're going to do the same thing. Remember, you always support both joints. You just put the arm back on the table. You can work a little bit more on the arm. So there's two ways to cover the arm back up. From this position, when the arm is back down to the side, I'm going to bring the drape out to 90, level with the shoulder. Pick up the arm exactly the way I did before, scooping into the table, rolling it into my hand, bringing it out to 90. From here, well away from the body, I'm going to bring that edge up and over. Just remember, it has to be over the hand that's holding the arm, or this won't work. You have to cover the hand. Now, what you can't see, what I'm doing with the hand that's holding the arm is I've got my thumb up in the air. That thumb is going to hold the drape out of the way and allow me to pull it down over the arm and recover. They will put their arm back. If you feel a need to put it back, if they don't move it, all you have to do is from the outside the drape, push them back to the table. Now, if I had not done that, and I had been moving their arm, before I put them back down, so I was doing ranging, moving the arm, working on the arm. Before I put it back down, if I wanted to combine the two movements, redraping and replacing the arm on the table, I can simply bring that out right there. Now I'm going to have to switch and put the arm back here and slide my hand down and redrape the arm. So it's up to you. You can do it either way. You can replace it, which increases the steps that you're doing, or you can combine the two and redrape as you replace the arm. It's kind of up to you. Okay. Now this is a man, but we're just going to show you how to demonstrate for the breast drape. You need a king-size pillowcase. A standard is not long enough. Or a sheet. Some people use a towel. Towels are a little rough against the skin. You're going to do an accordion fold. So once again, I'm going to bring it up into my palm. Then you're going to take your thumb and you're going to hook under either edge of that top edge of the pillowcase. This has to be shoulder width apart. So from his shoulder to his shoulder, or his armpit to his armpit, you're going to pick up, let go of the pillowcase. You just have your thumbs under the edge. With your fingers, bring it up and hold it with your thumb. So now I've got, between my index and my thumb, I've got both the sheet and the pillowcase held at shoulder width apart. Slip your other fingers under the drape, and as you pull this down, you're pulling the sheet and the pillowcase at the same time to cover the chest area. Now some people will stand here and adjust the pillowcase, but think about it. You're over them. Everyone feels a little insecure when there's someone's their hands or arms are in your face. It's just a natural response. You try not to bring out any of those natural responses that are from fight or flight. If they become concerned, the first thing their body does is squirt or release a little bit of adrenaline into the system because they feel alarmed. And every time they do that, it takes the body 20 minutes to dissipate that adrenaline. And we really don't want them feeling afraid or defensive when they're on the table. So I don't do this. I try to find some other way to do it. I'm going to step over to the side so that I'm not hovering over their head. And it's always the inferior hand that you use to reach across the body. Because if I do this, once again, I'm over their face and I might hit their nose. So always stand this way. Don't do it from this direction. And from here, I can adjust the drape. Now, you need to reach completely over, pull the sheet down. If they have disposable underwear on or if they're nude, you don't have to worry about tucking. But if they have their own clothing on, the one thing you don't want them to take away from your treatment is wet, gooey underwear, because that's what they're going to remember about your treatment. No matter how wonderful it was, that's the last thing they feel and they remember. So we don't want that to happen. From either side, remember we never go into the midline of the body in this area. From hip to hip, we're going to take the sheet, and from the outside, I don't need to touch him on his bare skin to find his underwear. With your fingers, simply tuck it under and pull it up, and it will completely fold over. Now, I don't have to worry about restricting my movements because I'm afraid I'll get oil on them, and I can do more of a flowing work. Now, on either side, if the person is nude, what you're going to do is take the back of your hand with your fingers pointing away, so it's not this hand, it's this hand, and you're just simply going to tuck and bring it under their hip. So on this side of the body, it would be this hand, fingers pointing down, dorsum of the hand, and just tuck and bring it under. Now, when you're done, once again, you don't want them to feel your bare skin against their bare skin. You're going to pull it out from the corner, dorsum facing their skin, okay? And just bring it up a little bit and run your hand along, and it's undone. If you can't reach over, walk around, but try to limit your movements and limit the ways that you work on the person on the table. Keep it to a bare minimum. Now you can pull this back up. Now you notice it was my inferior hand that went up on the opposite side, so I'm not hitting them. Now I'm going to hold the pillowcase on this side. I'm going to reach across and hold the drape with this hand, and you're going to do an Elvis Presley. You're going to pull it back and off to the side. So you're just going to go back and off like, thank you very much. If you pull it straight, you're going to hit them in the face. So you have to pull back a little bit. And you have to be in this position so that you're not hitting their face. Hips are very tricky. Please don't deny your patient or your client the benefit of ranging because you don't know how to drape or you're afraid to move the leg. You as a therapist need to practice enough to where you can actually do this. Our therapy, our profession deserves people who are willing to do the work and do a really, really good job. Once again, where you stand and how you do it with the minimum movements and the proper hand technique is really important. So you're going to stand between their knee and their hip. You're in your archer stance, which is asymmetric, feet wider apart than your hips. You're going to find the edge of the sheet and accordion fold it up, always being aware of where the edge is, because that's all I want to work with. I don't want to work with a lot of sheet. Now, bring it at an angle, put it where you want it, so it needs to be right there. What we're trying to protect is the hip area and the inguinal triangle, the femoral triangle. Before I did that, I could have uncovered the feet, or now that I've positioned it, I can uncover the feet. I need to uncover the feet to give me allowance to pull the sheet. So I'm just going to bring this up. I could have done it first, but I'm going to do it now. and uncover this leg completely. Now, I can do like this to make sure I know where the edge of that sheet is, because that's all I really want to grab and pull under their leg. You don't want them lying there on this big blob or wad of fabric. It's not comfortable. So I'm going to try to get it as smooth and flat as possible when I bring it under their leg. Now, just like we did at the abdomen, we're going to use the back of our hand on the outside of the sheet to find the edge of their underwear. All I'm going to use to tuck is the edge, maybe about that much. So once I found the edge, I can scoop under with my fingers, pull it away just like we did with the waistline, and tuck it under. You cannot tuck it all the way to the midline of the thigh. You have to come out a little bit because you still want to protect that inguinal triangle, the femoral triangle. So it's not completely dead center, it's a little bit more to the side, which we would call anterolateral. Now, if their underwear is not tight like boxer shorts, you really have a difficult problem. You have to roll it up and do the best you can. So the looser it is, the more fabric you want to put underneath it. The more fabric so it will stay. Be sure you go all the way down to the table. You should not see any fabric from the clothing that they're wearing. Now I can pick the leg up and move the leg a little bit. Whenever you lift anything, like with other ways where you have to be careful of your back, it's a little different in massage because you're moving a lot when you're lifting things. So some of the rules apply, but you have to apply them in a little bit different way. Always, always, always keep your elbows at your side. That is so important. No matter what you're doing, even if you're doing a technique, even an effleurage or a petrissage, your elbows should not be away from your body. This type of movement is not massage. You're washing clothes, you're doing something else. It's not massage. What massage is a body movement. It's a body movement. And if your elbows are at your side, that's exactly what's going to happen. You won't even have to think about it. It will happen naturally. If I pick up something that's heavy, I need to keep that weight balanced over my center of gravity. And I can't do that if my arm is out here. So if you have to tie a belt around you when you're practicing to keep your arms at your side, do it, whatever it takes. You're going to pick up the leg from the foot, and you're going to put that weight right here on your forearm. So I'm going to scoop him up, and I'm going to put him right there. Notice I'm not really even using my hand. I'm not grabbing and holding with my hand. I'm pushing forward a little bit, and it's going to be my body that lifts the weight, not my arm muscles. In fact, you need to drop your arm muscles. They should stay nice and loose. Don't be up like this. You don't need to do that. Let your arm drop. If their knee doesn't bend, break open naturally, you can reach under and just tap the back of the knee. But you want to keep it internally rotated, medially rotated. You want to make sure that the leg stays turned in. Just enough to get your hand underneath and grab the edge of that sheet. That's all you need to do. Don't put them way up in the air. You never want them to feel cold air on the back of their leg. So the first thing I'm going to do is take that drape, pull it up and under, and make sure they feel that against their leg. You're going to pull it down to the table and up to their hip before you move. Before you move, okay? Now I can push against the leg, keeping them turned in, and bring the drape up with me. Now I can let go. Now I can arrange it. Maybe I want it pushed down a little bit more. There's a couple of ways you can anchor it. If you think the person is going to be a little shy about it, you can let them participate. Give them the bottom sheet, let them hold it, then they control it. They know it's up against their leg. They can tighten it if they want. They're in control. Or, if you have enough sheet, you can throw it over the leg like this. Or, you can bring this under the small of their back. You want to hear vinyl, and I'll show you another thing that you can do with the abdomen by tucking the top part. But for this what I'm doing right here with this demonstration, we don't need the top part of the drape tucked. Or what I like to do is I like to bring this up and tuck it into the clothing itself. So all the way around that leg, I've got that drape tucked into their fabric. And once again, you try not to touch their skin, and you don't have to. You can do it without your touching. So when I put the leg down, it should look like a teardrop. It should come up high on the edge because you want to be able to work in that hip area, but you don't want it moving. Now I can rearrange this and do this a little tighter, whatever I need to do, and I'm going to pull it and get that out of the way because that might start moving on me. Once again, do not go into the midline of the body. You're going to reach across to the other side, and you're going to pull that extra fabric out of your way. Remember, this is no man's land. This is the DMZ. You never go in there because you don't have to. So you just don't do it. Gross body movements. If I were going to range the hip, you want to put your gross body movements together so that once they get settled back on the table, you don't have to wake them up again. So if I started with them face up, after I did my massages, the whole body, then I would do the ranging. If they start face down, you're going to turn them, and after you turn them, before they settle back into the table, you're going to do all of your big body movements. So they started what we call prone, face down. I would turn them over to supine, range the shoulders, range the hips, let them settle back down on the table, then continue with the massage. But the beauty of massage is there's no one way to do anything. There's no right and wrong, except don't hurt them, don't embarrass them, don't make them afraid, and don't make them angry. That's about it. Everything else is your artistic ability coming through to make that an enjoyable massage. So the least amount of movements that you make is going to make it more enjoyable. Nothing jarring, have it flow from one to the other. All of those come into making a composition that is enjoyable. You're an artist like a chef. A chef has to know how to cook. He has to know the chemistry of how to prepare the food to keep it sanitary, but he also has to make it enjoyable, a palate for the taste and for the eye. So there's the visual component and the taste. And with us, it's the same thing. We have the touch that the person experiences, the sounds that they hear, the colors that they experience, all that goes together to make it an enjoyable treatment that you give them. So I've put the leg back down, I did all that. Now I'm going to work on the leg. So once again, remember, you pick it up, you turn it in, you break the knee, and now I can move the leg whichever way I'd like to move the leg, and I don't have to worry about them feeling that their body's exposed. And then to put it back, once again, you have two ways to do it. You can do it from here before you put them back down on the table. So as I'm standing here, I'm going to take this, but I tug it a little bit so they still feel it. And as I bring the leg down, I bring the drape down as well. You always redrape away from the midline. Remember, all of your movements are away from the midline. They're never towards the midline. Someone's natural defense mechanism will kick in if they feel that you're coming towards their midline. They're going to want to protect it, so you never want them to feel that way. Come up here, untuck it, hold it, and redrape the leg. Redrape the leg. Or, once you've put the leg back down, and I'll just do this for demonstration purposes, I'm going to pull this out, pull this down, get it as close to the leg as possible, pick the leg up, pull it under, put the leg down, make sure that it's loose so you can tug it back over the leg, but you're always going to take the drape and pull it this way. Stand back from the table. Do not do this. What you just did was you exposed them and they felt this rush of cold air. It's not very comfortable. So it's always a pulling motion to keep that close to their body. Now there's a couple of other ways to drape. I may want to do something called a spa drape. I may want to do my work on the body as a whole. This is very useful if someone comes in late. They booked an hour massage, but they showed up 15 minutes late. And you're down to maybe 30 minutes on the table. The less numbers of ways to break the body up gives it the illusion of more time. So if I'm going to work on this side of the body and all I have is 15 minutes and not 30 minutes or 25 minutes, I'm going to want to cut down the number of stops and starts that I do. So I'm going to want to do the whole body. So I need to uncover both legs at the same time in order to do that. This is called a spa drape. So if you're doing body treatment, you're going to do this as well. Find the middle of the sheet so you'll know how much you have for each side. Bring it up above the knees and do what you did before. Okay? You're going to uncover, bring the leg up. You know where the edge is. Okay? It's right there. And I'm going to bring all of this, but just this much of the sheet. I need to leave that over there for that leg. And I'm going to do the same thing that I did before. I'm going to tuck it into the underwear on either side. Well, anyway, could you see that in the film? All right, let's do this side too. All right, here's the edge. I know where the edge is because all I want to work with is the edge. Remember, always bring anything up against your body. You never have your elbow out to the side. It's always against your body. Stay relaxed. Bring the leg up just far enough to grab the edge of that sheet. Just enough to bring it up. Now that it's up against the back of his leg, I can walk up with the leg if I need to. But in this one, you really don't need to do that. Just get it up as high as you like. And you're going to tuck it all the way around from the top to the bottom. Now, we usually call it a spa drape, but what we used to call it is a diaper drape, and you can see why. And you can see why. So with a footstool, I will be able to work on both legs at once. I can go from one side to the other side, and it will basically be the same length of time, but it will feel much more complete to the person on the table. Now, I could do the upper and lower body at the same time simply by making a breast drape for the women, if not for the men. You don't need that. And you're simply going to bring this down. Tuck it. Put their hands over, and you can go what we call nose to toes. So I can work my strokes all the way up and down the body completely, all at one time. And if I do it this way for 15 minutes, it feels much better to the person on the table. Something that we don't do anymore that we do need to do is have a heat lamp in the room. It'll help a lot, but most people don't have one, but it's a good investment. And a table warmer. Basically, if the bottom of the table is warm enough, they pretty much stay warm enough. And remember, you're in a room alone with them. Nobody's opening and closing doors. You can always dampen the air conditioning when they're on the table. Okay? To re-drape, once again, don't touch them with your hand. You don't need to. Pull that up. And it doesn't matter which leg you do first. You're going to pull it out from the underwear. Turn the leg in, break the knee just enough to get that out from under. Midline down. Lift the leg, break the knee, turn it in just enough to get that under. Put them back, untuck, and bring it down. Now, if I were going to do that, or if you feel the person would be a little less secure knowing that their skin was exposed when you're moving their hips and their legs around, we can do something we call the mummy drape. pull the bottom sheet as tight as you can and bring it over. Grab the bottom sheet, pull it, and when you bring this, make sure their legs are together. So you're going to pull their legs together. Make sure they're tight and make sure this is tight. And you want to come up over the hip so it looks like a mummy. Down here, I'm going to grab that and turn it. Now I'm going to pick the legs up the same way I did before with my forearm. I'm just going to put 2 feet on there now instead of 1. Both feet right there. Break the knee, walk up, and bring their legs up with you. Now if you're turning in one direction, it's called an archer stance. It's still very basically like the horse stance, only one foot is in front of the other one. And keeping your back straight. See my elbow? Where's my elbow? It has not left my body. It stays right there. They aren't exposed anywhere. They're completely wrapped in the sheet so they feel totally secure. And now you're going to be able to help them loosen up their low back. So if they tell you they have low back pain, you should do this. You need to stretch them out. You can have them breathe for you. You can bring the knees up. You can do circumduction. You can do AB and adduction. And you can even do a straight leg flexion. See, once again, did my elbow leave my side? No, it didn't have to. It did not have to. And then you're going to put them back. And to redrape, you just simply pull that bottom sheet back out. One thing you're always going to be aware of is whenever you're moving the sheet, you have to check and make sure that you've put it back where it should be, which is level, equal on each side of the table. So that is the draping for the leg, the draping as a mummy wrap and also as a spa drape or a diaper drape, the 3 different ways you can do it. Now when you are working with men, you need to be aware of where you position the drape, and with women. The top of the drape should never come up above their décolleté line, which is shoulder to shoulder. If you see it move around, put it back. Inferior hand goes across the body, put it back down. When there are men on the table, you want to do something that's called a visual shield. You want to give them a little privacy. So we're always going to make sure there's some folds in the sheet. It doesn't have to be flat. You're not going to pull it tight. You're going to give a little bit of room in the sheet. Okay? So we're going to have him turn over. Don't make the mistake of not fixing the face cradle first. The table has to be ready to go when they turn over. You don't want them turning over and then having to sit up on their elbows waiting for you to fix the table. So I'm going to make sure my face cradle is in the right position before I ask them to turn over. So the neck is the most important thing, so I'm not going to take that towel out from under his neck until I'm ready for him to go. So the first thing I'm going to do is check my drape, make sure it's even, and I'm going to take the bolster out. It's kind of up to you if you take it out or not. It's sometimes I do, sometimes I don't. It's not really gonna get in the way, but how you do it is important. You pick them up like a diaper drape, and you pull it out like that. Usually they'll pick their legs up, but like you really don't want them helping you. If you're doing therapy, it's a different story. But in Swedish, you don't want them helping you. You want them to be in a alpha state, which is daydreaming. If they're not having to participate in what's going on around them, they can just relax and enjoy it. But you're asking them to come back into beta when you ask them to do things for you. It's a whole different way they're thinking. And for some people, it would be very hard to get back into that alpha once you've asked them to help you. Now they're paying attention when you really don't want them to pay attention. Do not put your drape on the floor. Do not put your pillow on the floor. All right, I've checked my drape. Everything is straight. The pillow, the neck support, the head face cradle is ready to go. Now, if you'll notice, what I've put on here is a sheet. If you take a sheet, that you can buy some smaller ones, they're called juvenile sheets. Lengthwise, fold it like this, place it across the face cradle, punch it down as far as your arm will go, reach under and bring it up. It's a very comfortable, nice face cradle cover. You can buy some, you can use a pillowcase, but this seems to work the best. And this one doesn't move around on them with the sheet. Now I'm ready to ask him to turn over. So I'm going to lift his head, take this out, put his head back on the table. Now I'm going to stand shoulder to hip. For the legs, it was knee to hip. Now it's going to be shoulder to hip. Reach across and lift at the shoulder and the hip, making a little tent. And you're going to instruct them what to do because they don't know what to do. I'd like for you to turn over onto your stomach, please. Bring this shoulder to me. Turn all the way over onto your stomach. And as they turn, watch their feet. Do not let them look up and see you staring down over the edge of that sheet at them. I usually do it in 2 steps. Now, he's a therapist, so he knows what to do. So once they've turned over, then you ask them to scoot down and place their forehead on the face cradle. Give visual and tactile cues. If they don't know what to do, say, place your forehead on the face cradle, because it needs to be right here. You need to be able to look under and see eyes and nose and mouth. So you ask them to scoot down, then you ask them if they're comfortable. Are you comfortable?
Yes.
And you ask them if they're warm. Are you warm enough?
Yes.
Okay, great. Then you go back. Now that their head is secure, it's in the right position, they say they're comfortable. Now you can place the bolster back under their ankles. Once again, bring both sides up. Do it like you're changing a diaper. And under the feet. You can do it from the side, but what happens when you do it from the side is you have to slip your hand under the person, your elbow has left the side of your body, and you lift up the legs. They could be 25, 30 pounds of weight. If you only do it once, it's okay, but what if you have an 8-hour shift and you had to do that 10 times? Or 5 times even. By the end of the day, how many pounds of weight did you lift? You can only hold up that kind of work for so long. So we're trying to learn to pace ourselves, we're trying to learn to take care of ourselves. And certain movements that we do, we want to keep to a minimum, and we certainly aren't going to do it where we're going to have to exert any kind of force unless we absolutely have to. You need to stay loose and relaxed and keep your muscles down and let your body do all the work. Don't let your muscles do the work. You've got gravity on your side now. It's not something you're fighting. You're actually using it to your benefit. Now in this position, you really don't need to worry about the drape for the shoulder. But if it is a woman, and if they do have a lot of breast tissue, or they're elderly, or whatever you may think culturally, they might be a little nervous being on the table. The towel that you used under their neck, you can take one and roll it up lengthwise and place it on either side of the body. So I could put this right here for a lady, and then she wouldn't have to feel that very vulnerable part of her body was exposed. Most people who get massages all the time, they're more than used to having a massage, and as long as you're not exposing that breast tissue, they're quite all right with it. But you need to have this handy. You can't go in there without your linens, just in case. You might need it, so you need to make sure that you always have this with you. Now for the hip, once again, I don't want to get oil on his underwear, so I'm going to come from the hip. If you always do this, you don't ever have to worry, do I have to do it this way or do I not have to do it this way? I just always do it this way, then I don't have to make that choice. I'm always at the hip. I'm not in the midline. And I just from the outside reach under and pull it up and tuck it. Okay. You'll see some people show you to do this on videos on YouTube or wherever. It's not necessary. Why hurt yourself when you don't have to? Now I'm talking sleeves. There is some therapy work that you'll do where you'll need to pick the leg up in this position, but there's other ways to do the very same thing they're showing you to do where you don't have to do that, where you don't. So in this position, I really don't need to pick the leg up and bring the sheet under the same way I did before when they were supine. First of all, it's very difficult to do because now the knee is going to bend on you. You can't keep it straight. And legs are heavy. It's a weight I don't have to pick up. So I'm not going to. I'm not going to. I'm going to do the same thing I did before. Accordion fold, bring up so you know where the edge is. From below the knee, distal to the knee, and at proximal to the ankle, you can bring the leg over if you want to move it apart. And with just the edge, remember we always want to use the dorsum of the hand and the fingers pointing down. I'm just going to roll his leg out a little bit, and I'm going to tuck that sheet right there. In this position, that's really all I need to do. I could have done this first, doesn't really matter. Up here, once again, you're going to make sure that their clothing is protected. If they're in disposable underwear, if they're nude, you don't need to do that. It's only if it's their clothing that they have to wear out of that room that you want to make sure it isn't cold and oily when they leave your room. Pull this over if you need more to get it out of the way, not from the midline. Now I can work on that leg. I can come all the way up. Remember, you want to come up on the outside as high as possible. I can range the knee. Now if I wanted to move the hip itself, I can simply get into my wide horse stance, lift it, keep my elbows at my side, and move that hip around. Circumduct, rotate inside and out without having to pick that leg up and pull that drape completely underneath. Completely underneath. A really good position to work the leg in. Hold the drape and the knee, proximal to the knee, medial side. Bring it out and lay the leg down. You're going to need to bring the bolster up. If they're not able to lay their leg down, you're going to need to put another towel here or hold it. Don't let them try to just be suspended in the air because they need to relax. You can't work on the muscle if it's contracting. That does not work very well. So if I needed to come up a little bit in the hip, once again I can do that. I can adjust it up here, bring it up a little bit more. Now without me bending down and having a bad angle to my wrist, I can work on the outside of the leg. I can work on the outside. To put it back, you simply bring the knee up, hold the drape and the leg, and put the leg back. It's very simple. To redrape, loosen it at the hip, go down away from the midline, and cover the leg back up. So in this position, in what we call prone, it's a very simple thing to drape the person.